we actually have a graphic of the different treatment options that are available. And Dr. Linfante, if you can talk to us a little bit more about this microvascular clipping and the endovascular treatments, that would be so helpful to our viewers.
Yeah, I have some slides also, we can go through it. So, but there's the traditional surgery, the way aneurysms have been treated up to 10, 15 years ago, these are still are treated, is traditional surgery, which is to, maybe we can do that, we can show the slides.
Doc, if you'd like to actually show us a little bit.
Okay, so
here on the slides.
Yeah, okay. So in the slides, the traditional surgery, you can see you need to do an opening of the skull. And at this point, you find the brain, and the brain has different sulci. You have to expose, open up the brain, find the vessel, which are usually at the bottom part of the brain, and then put a clip. Really looks like.
It looks like a clip. Yes, like a paper clip.
It is a clip that you put at the neck of the aneurysm, so that the blood doesn't go inside the aneurysm anymore. But this is very invasive. It's a complex surgery, and it's very invasive. In the vascular embolization, that you enter the artery from the groin, and you use the body vessels as your highway to reach the brain vessels.
Wow.
Once you reach the brain vessels, you find the aneurysm. You can access the aneurysm, and these are like a few millimeter lesions. Some of them can be very difficult to treat. And then one thing that at the beginning of this whole story, when we start working on this and develop these first techniques, is to fill it up with platinum coils. So you fill the aneurysm, this pouch, with these coils, and then eventually the blood will clot on top of these coils, and in this way you exclude the aneurysm. I have some examples of a patient. You can see on angiography. We do this in angiographic room. So into a contrast goes where blood goes. So these are normal vessels. Okay. And you can see in this case the artery has been completely blown out. But this aneurysm, it was a ruptured aneurysm.
That's a ruptured aneurysm, correct?
Exactly.
Yes.
So this is so you can see a ruptured aneurysm with these very odd shapes, because basically the whole thing kind of burst out. So in this case, we're able to access from the groin this lesion and fill it up. You can see with coils. At the end of the procedure, you can see that the blood just takes the normal route, and blood doesn't go inside this pouch anymore. Therefore, it cannot burst anymore.